Did you know that every 40 seconds, someone in the United States experiences a stroke? Nearly 140,000 Americans die from strokes each year. Imagine your life, or a loved one's life, hanging in the balance as the clock ticks faster than you realize. Furthermore, stroke is one of the leading causes of long-term disability in the US. Hello everyone, and welcome back to Neuroperformance Lab, your go-to hub for cutting-edge health and neuroscience insights. Today's topic is one of the most important medical emergencies out there: strokes. Strokes don't just happen in medical TV series, they occur in real life, often when you least expect them. So grab a notepad, because by the end of this video, you'll be armed with all the key facts to keep you and your loved ones safe. Before we get into the nitty-gritty of symptoms, let's quickly cover what a stroke is. Simply put, a stroke occurs when blood flow to part of your brain is interrupted. There are two main types: ischemic stroke and hemorrhagic stroke. Ischemic stroke is caused by a blockage, usually a blood clot, obstructing an artery. Since the brain cells depend on a constant supply of oxygen and nutrients, this blockage rapidly initiates cellular damage. Hemorrhagic stroke happens when a blood vessel in the brain ruptures, leading to bleeding. Now, hemorrhagic strokes can be further divided into subarachnoid or intraparenchymal hemorrhage. Subarachnoid hemorrhage often presents with a sudden severe headache, described as the worst headache of one's life, accompanied by nausea, vomiting, and altered consciousness. In intraparenchymal hemorrhage, bleeding occurs within the brain tissue itself, and while the headache might not be as dramatic, you might notice sudden weakness, confusion, or numbness, depending on the affected area. Now, let's get into the heart of the matter: the stroke signs you absolutely need to know. The easiest way to remember these is with the FAST acronym. And no, I'm not talking about your Wi-Fi speed. F is for face drooping. Ask the person to smile. Does the lower part of one side of their face droop or feel numb? Even if it's subtle, think of it as your brain waving a red flag, like trying to smile for a photo when one side just won't cooperate. A is for arm weakness. Next, have them raise both arms. Does one arm drift downward or feel unusually weak? This isn't just about muscle control. It's about understanding that our brain controls strength and movement on the opposite side of the body. When one hemisphere is affected, you might see weakness, hemiparesis, or even numbness, hemisensory loss, on the opposite side. S is for speech difficulties. Ask the person to repeat a simple phrase. Are their words slurred or hard to understand? There are two types of speech issues you might notice: Dysarthria and Aphasia. Dysarthria is a motor speech disorder caused by damage to the motor areas of the brainstem, cerebrum, or cerebellum, resulting in slurred or slow speech, even though the individual fully knows what they want to say. Aphasia occurs when the language centers are damaged, leading to difficulty in forming words or understanding speech. Either way, garbled speech is a major red flag. Now imagine this real terrifying scenario. A man is alone at home, emptying the dishwasher after breakfast. As he reaches for a plate, he suddenly feels strange. He tries to say something, but the words won't come out. He knows what he wants to say, but he just can't form the words. The man was manifesting aphasia, to be more specific, expressive aphasia. Thankfully, at that very moment, he's on the phone with his wife. She hears him suddenly go silent, then try to speak, but he just can't. She immediately recognizes that something is wrong. This isn't just mumbling or being distracted. It's a medical emergency. She calls 911 immediately, and that quick reaction saves his life. And finally, T means time. Every minute counts. In fact, Research shows that nearly 2 million brain cells can die in just 1 minute during a stroke. The faster you call emergency services, the better the chances for stroke recovery. While FAST covers the primary signs, strokes can manifest in other critical ways. Here are some additional symptoms you need to be aware of or that need to be clarified more appropriately. Vision problems. Your eyes and brain work together seamlessly, so sudden vision changes are alarming. Sudden loss of vision in one eye, known as amaurosis fugax, can feel like a dark curtain briefly sweeping over one eye. Homonymous hemianopia, or losing half of the visual field in both eyes, say the right side, points to damage in the brain's optic pathways. Double vision, or diplopia, occurs when the eyes no longer work in perfect coordination, often due to a stroke affecting the brainstem. Visual field deficits and blurred vision can be less specific, but still contribute to the overall picture. Sensory and strength deficits. A stroke can lead to sudden numbness or weakness, not just in the face, but potentially affecting an entire side of the body. This pattern, known as contralateral deficits, is a clear sign of central nervous system involvement. It is important to note that a stroke can produce isolated deficits affecting just one arm or one leg, as the precise pattern depends on the location and extent of the lesion. Severe headache, particularly common in hemorrhagic strokes, a sudden, intense headache with no apparent cause is a critical warning sign. Knowledge is power. Stroke awareness isn't just for medical professionals, it's for everyone. By understanding these signs, you become an active participant in stroke prevention. Here are a few quick, life-saving tips. Manage your blood pressure. High blood pressure is one of the leading risk factors. Monitor your cholesterol. A balanced diet and regular checkups can go a long way. Stay active. Regular exercise keeps your cardiovascular system in top shape. Manage diabetes. Controlling blood sugar levels, if you have diabetes, are also crucial steps in reducing stroke risk. Avoid smoking. It significantly increases your stroke risk. Avoid alcohol. These aren't just tips for a longer life. They're essential steps and the bare minimum to ensure you can truly enjoy every moment with your loved ones. Let me share a real-life story to drive this home. Mr. Smith, a 68-year-old right-handed man with no prior history of stroke, was having breakfast when he suddenly found himself unable to speak clearly. His words came out halting and garbled, and he began to struggle with forming sentences despite knowing exactly what he wanted to say, a classic sign of aphasia. Within moments, he also noticed that his right arm and leg felt weak and numb. Alarmed by these sudden changes, his wife immediately called 911. On examination in the emergency department, Mr. Smith demonstrated non-fluent aphasia with impaired word finding, and neurological testing revealed right-sided hemiplegia, or paralysis, along with hemianesthesia, or loss of sensation, on the same side. These contralateral deficits indicated that the lesion was in his left hemisphere, the dominant side for language in the majority of right-handed individuals. Upon arrival at the emergency department, Mr. Smith underwent a comprehensive imaging workup. A computed tomography, or CT, scan with MDC and an angio-CT of the head and neck vessels were performed, revealing that the occlusion was in the proximal segment of the left middle cerebral artery, also known as the M1 segment. The MCA is one of the three major arteries that supply blood to the brain, and it supplies extensive areas of the cerebral cortex and deep brain structures. If you found this video informative, please give it a thumbs up, leave a comment below with your thoughts or personal experiences, and hit that subscribe button for more essential health and neuroscience insights. Share this video with friends and family. Knowledge is power, and in this case, it could be the difference between life and death. This would mean the world to us because we work hard every day to bring you qualitative evidence-based information that can truly make a difference. In our upcoming stroke series, we'll dive deep into fascinating clinical cases that illustrate stroke prevention, treatment, and recovery, from real-life stories and detailed imaging findings to the latest research on how to save lives. Medical disclaimer: the information presented in this video is for educational purposes only and is not intended to substitute professional medical advice. Always consult a qualified healthcare provider for diagnosis, treatment, and any medical concerns. Stay informed, stay safe, and remember, when it comes to stroke, every second counts. Take care of your brain and your heart.